This film concerns a 6-year-old autistic girl during the 4th year of her stay in the child psychiatric hospital. We shall deal in particular with her preoccupation with clothes. By way of introduction, we see some shots dating back to the initial phase of her hospitalization. Next, we see how her special attention is focused upon the clothes of her therapist. There follow some shots dating back to the period of institution of a medicinal treatment. We then see her busy with clothes in a new manner. She calls this krokkelen. Finally, we follow the patient until the 10th year of her life. Again we see a few scenes which concern the clothes theme. Here the patient is a little over 3 years old. We see her together with her twin sister. Josie shows her stereotyped rocking in time with the music. Meanwhile, her sister hops to and fro across a chalk line. It's likely that the girls are identical twins. This is our patient. Her face has a serious expression and she is often absorbed in herself. Such few sounds as she produces are incomprehensible. This is her twin sister. She is cheerful and open to her fellow men. Josie has never chewed up to now. She spoons up the yogurt by herself, but when cookies are strewn over the yogurt, she tries to avoid them. If she accidentally gets a piece of cookie in her mouth, she spits it out. She's careful to suck the yogurt from the spoon in order to avoid as much as possible getting a hard piece in her mouth. Four months later, the therapist has managed to establish some contact with the patient. She presses him against the floor and experiments with his body. She is especially interested in the therapist's mouth. Her attention is tense and anxious. 6 months later, her attention extends also to other parts of the therapist's body. She presses her mouth against these parts and displays a very close sniffing type of contacting. She uses her lips only. Her teeth remain covered.
Wat vind je nou het lekkerste ervan? Vind je het allemaal lekker? En Joseetje lust ook alles, hè? Ja, Joseetje eet ook alles op. Kijk maar. Verleden jaar kon ze dat nog niet, weet je wel. Nee?
A year after starting treatment, the patient can chew. Her oral movements are less coordinated than her sister's.
Heel goed.
18 months after starting treatment, she plays a game with the therapist in which weighing scales are used. The scales have short white legs, which the patient probably experiences as some sort of teeth. The therapist is expected to make the scales perform biting movements. Josie pushes a puppet under the scales, but at the last moment withdraws it from its biting.
Wat doen we nou? Wat doen we nou, zeg? Wat doen we nou? Wat mijn hand te doen? Opgetild. We vinden het wel erg spannend, hè? Daar ligt hij. Daar ligt hij. Kijk eens, José.
She is less interested when the therapist makes his own teeth perform biting movements. She is not afraid, but this form of biting fascinates her less than the moving scales legs, which bite in a more sublimated form.
Zo, mooi. Dan gaan we je schoenen aantrekken. Ja. Je bent een beetje uit je doen vanmorgen, hè?
We are in the early days of the 4th year of treatment. In this period, Josie frequently undresses during the therapy hour.
Gaat hij niet open, de rit? Ja, zo is de rit open. Mooi, zeg.
The clothes of the therapist must come off also. All his buttons must be undone, even if this is not functionally necessary.
Ga je die knopen nou ook losmaken? Die knopen hoeven niet los, de jas gaat toch al uit.
Nee.
Alle knopen moeten los. Ook die van de centuur.
The therapist says that it is not necessary to undo all those buttons.
Moet je die van de mouw ook nog losmaken?
Josie uses a neologism when she tells the therapist to button out.
Alle knopen.
Knopen.
Uitgeknopen. De knopen moeten uit. Zo,
Josie makes talking noises which are practically all unintelligible.
Oh, daar hangen we in. Daar hangen we in. Met vanaf om.
Zo.
Kloppen.
Nou, les.
When she lays the table, Josie puts the very precisely folded stack of clothes on the table too.
Nee, kleren.
Dat zijn de kleren, ja. Kijk,
Flessen. Hier zijn nog bekers. Hier zijn nog bekers. Zie je nog? Ga maar zitten. Ik ga ook zitten. Dus ik ga zitten. When the therapist invites her to sit down as well, she clearly says no. She continues to babble vaguely about a piece of chocolate. Chocolaatje.
Ja, even proeven, hè?
Even proeven, ja. Even proeven. Goed zo. Zo. Al vol, al vol. En dat is heel zeker. Zo, op. When Josie has poured, she remarks, "Well done." The therapist compliments her about it. Heel flink als je dan zelf doet. Ja. Ja, dat is heel flink. Dat is heel knap. Ga je er ook wat van drinken, José?
Wat zie je nou?
Zal ik het eens proeven? Dat is lekker.
Lekker. Oef nou.
Oef nou. Vindt de dokter lekker? Oef nou. Ik vind het lekker hoor. Lekker. Limonade. The therapist asks her, "How do you like it?" And Josie replies, "Nice." Hoe vind je het?
Lekker.
Lekker? Mooi.
Ja.
Mooi. Even lekker koffie drinken. Zo. Zeg Josie. The therapist tells her to dress again. En dan gaan we ons er aankleden. When Josie becomes interested in the clothes of her therapist, her behavior becomes stranger. It is difficult to approach her. She responds less and is more autistic. At other times she is more active but wild and confused. In view of the increasing psychotic aspect, medication will be started. In advance, exposures are made on 2 occasions during meals. Later, during medication, this filming is regularly continued. Today we see her in a state of intensified autism. She disregards her environment and seems to be lost in thought. After some hesitation, she suddenly takes a bite. She shakes her head and stares in the distance. Today she is more restless. Her activity shows stereotyped features. Sometimes she is impulsive and erratic. For 4 days, Josie has been receiving the initial dose of a drug with a pronounced antipsychotic action, the neuroleptic triperidol, which is a butyrophenone derivative. In the course of 10 days, the dose is gradually increased to the provisional optimum. Today her eating is conspicuously eager and uninhibited. She has now attained what is the maximum dose for the time being. Her interest is focused more on things and people than it was. Her movements now seem somewhat decelerated and difficult. This hypokinetic effect is ascribed to the medication. To control it, she receives in addition, starting today, 75 mg orphanedrine daily. Orphanedrine is an anti-Parkinson drug. The medication has remained unchanged. Today she displays a conspicuously well-adapted and cheerful behavior. A week later, she pays attention to the ward nurse cutting meat. Staring and stereotyped movements have not disappeared. The patient is now 6 years and 11 months old. A month has elapsed since the previous shots. She is still receiving medication, even at a slightly increased dosage. The general impression is that she takes a greater interest in her environment and is better adapted. In therapy, she continues to elaborate the close theme, which seems closely related, and her phobia for biting. As she starts to undress, she announces the game of krakkelen.
Oh ja, je wilt strakkelen. Krakkelen.
As an introduction to krakkelen, Josie undresses while she enumerates her fears and also pronounces reassurances.
Dat is de blouse. Dat is de blouse.
She says, "Doctor is not pain," and then, "Doctor is not gum,"
Dokter is niet.
and then, "Inside is not gum."
Binnen is heel
She says, "Need not cry," and mumbles various incomprehensible sounds.
Nee.
Dit is een monster.
Ja.
Dit is een monster.
Wat is er met de mond? En dat is een petticoat. José, wat weet je nog?
Josie again announces her intention to krakkelen. She now says, "Strak krakkelen."
Spaarkrakkelen.
Strak krakkelen, ja, daar gaat het om. Strakke krakkelen.
This can either mean tightly or presently krakkelen.
Omdat het zo strak krakkelen is. Hè? Zo. Moet je tas uit? Moet ik het ook maar zelf doen? Zo. Dat weet ik langzamerhand al wel. Alsjeblieft. En hebt ook nog handen?
Pijn.
Doet het pijn? Ik heb het niet gezien.
Krakkelen.
Krakkelen, ja.
On top of the therapist's clothes and her own upper garments, she dons her own underthings, which are now a rather tight fit.
Dat is de volgezin, hè? Nou, de petticoat. Dat is de petticoat. Dat wordt een beetje ingewikkeld, hè? Nee, dat is je arm. Ik zou een das aandoen. Ik zou een das aandoen. Dat is de das, die heeft ze ook aan. Ja, zo is die over de hoofd. Ja, piep in. Ja, piep in.
She attacks her stuffed bosom with her hands, but as a rule she does not really touch it.
Ga je nou brommen? Is het nou net een brom weer? You see? Het is mooi strak, hè? Het is wel mooi krakkelen.
She often makes growling noises when bringing her hands to her breasts. We have now approached the central problem of krakkelen.
Nou. Ja, je hebt één been. Je bent een beetje aan het brommen. Je bent een beetje aan het brommen, hè? Ja. Mag dat bromweer zijn? Je vindt het wel mooi, hè? Maar ook een beetje bang. Hoeft niet bang te zijn. Staat helemaal strak met je dikke buik. Oeh, wat een dikke buik heeft José.
After much hesitation, her hands finally grab the clothes between her chest and abdomen.
Ja, dan pak je hem stevig vast, hè? Nou kan je ook wel gaan brommen. Ja, dat is wat je juist niet durft, hè? Zal ik het eens?
The therapist now begins to sing the old familiar lullaby. Naughty though she be, we love her as you see.
Is Joseetje nog zo stout? Iedereen tot van haar houdt. Hey, ja, ik heb ja. Josie mag er niet schreeuwen. Is Joseetje nog zo stout? Iedereen tot van haar houdt.
The therapist comments, "You are anxious about it. You need not be afraid. Yes, krakkelen."
Krakkelen? Wat krakkelen? Zeg. Waarom weer? Waarom weer? Wil je iets knappen? Ja, wil je iets knappen?
She has a very long look at herself in the mirror. Finally she says, "Does not hurt."
Doet geen pijn. Nee. Doet geen pijn. Nee, doet geen pijn. Doe zie.
When Josie assumes a more active attitude and keeps her arms akimbo, the therapist asks her to look at him. Then he begins to sing a different song from Red Riding Hood. I'm not afraid of the wild animals in the woods, in the woods.
Ben niet bang voor de wilde dieren, ben niet bang. Ja, je bent niet bang. Het zijn geen wilde dieren. Kijk ze eens. Ja, durf je nou toch niet goed? Durf je nou toch niet goed?
Josie mumbles something incomprehensible and then says, "That is doctor, petticoat."
Dat is een dokter.
Then she ventures to grab the therapist by the shoulder.
Een donkere stem. Wat praat je nou met een donkere stem? Boem. Durf je me nou al aan te pakken? Durf je me nou al aan te pakken? Nou, dat valt toch mee, hè? Dan ben je niet meer zo bang voor me. Zal ik je dan maar niet meer aankijken? Dat is mooi, hè? En niet bang voor de wilde dieren en niet voor de dokter. Heb je nou weer vast, hè? Als je het van mij ziet, dan ben je het griezelig. Zal ik hem nou eens vastpakken? Vind je dat prettig? Oeh. Ja. Net als de dokter. Ja.
Die koffie en zo en luisteren. Ja.
Josie continues to admonish herself. She says, "Must not touch,"
Josie, niet aankomen.
but at the same time firmly strikes her own abdomen. Then she says rebukingly, "A good hiding," and strikes her upper hand.
Goed begrepen?
The therapist repeats what she has said. He reassures her that she may touch herself.
Hè? Niet aankomen. Niet aankomen. Dat dacht je, hè? Dat je het niet mocht. Dat mag wel. Het mag wel. Het mag wel. Dik voor je broek. Nee, José. Nee, dat mag je er niet aankomen. Hop. Zo. Dat is elkaar.
Ja.
He expresses her doubts in the words, "Touch it, don't touch it," and he concludes, "But you may do so."
Wel aankomen. Het mag wel. En wat is er met José? Is die hele cake?
Nee.
Josie grunts. What's happened now?
Nee, is er gebeurd.
Ja, dat is er wel gebeurd.
Then the therapist shows that he himself is not afraid to touch or grasp, but Josie turns away to avoid seeing this.
Ik kan het ook wel. Oh, maar. Ik durf het ook wel.
The therapist says, "You would like to continue to krakkelen, but now we are going back to the ward."
En dat is de petticoat van José. Nee, die wil je liever niet uitdoen, hè? Die wil je liever niet uitdoen. Aanhouden, je wil er niet krakkelen. Zo. Dat doen we toch. Die petticoat is zo.
He accepts her resistance, but all the same he makes her change her clothes.
Maar even over je armen doen. Zo. Nou werk je alweer een beetje mee, hè? Ja. En de onder. Douche uit. Hè?
Krakkelen has continued to engage our patient for quite some time. Even when she has finished with this theme, she continues to be interested in clothes. Rather more than 6 months later, she has dressed up as a queen and comes into the therapy room.
Mooie lichtjes. En jij hebt de mooie kleertjes aan. Zal je jas even uitdoen, José? Het is veel te warm. Zo, dan heb je toch nog hele mooie kleren aan. Kijk eens wat een mooie kleertjes. Doe je jas even uit. Ja. Ja. Stel je maar op je mooie kleertjes. Zeg, wat ben je nou op het ogenblik?
Some 6 months later, when she is 8 years and 4 months old, she is in the ward making clothes for her dolls.
Det kan jag säga, det kan jag säga.
The patient is now 10 years old. For the past 18 months, she has been at home with her father and stepmother. Her twin sister looks and tells us that Josie is drawing a woman with a knot of hair.
Weet je nog dat je vroeger ook met José op de film kwam, Carrie? Weet je dat dat nog was met de hamsters, hè? Goed zo, Joske. Met hamsters.
This is the drawing which Josie made. It reminds us of the crocodile that preoccupied her 3 years ago. That same day, she is singing while helping with the washing up.
Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday to you.